All right, welcome to The Explainer. Today, we're tackling something that's on pretty much everyone's mind, the absolutely wild and, let's be honest, super confusing cost of healthcare here in the US.
So let's just kick things off with one number. Just one. Get ready for it. $4.9 trillion. That's what the U.S. spent on healthcare in 2023. And look, that's not just a big number, that's a massive, massive chunk of the entire U.S. economy. And really sets the stage for, well, everything else we're about to dig into.
And this chart right here, it really puts that number into perspective. You can see just how much of an outlier the United States is. I mean, as a piece of the economic pie, what we call GDP, the U.S. is spending way, way more than any other high-income country. And this isn't some new thing, you know? This gap has been huge for a long time. So this all leads to a really big question, right? It's something people call the American healthcare paradox. I mean, if we're spending that much more than everybody else, you'd think we'd have the best health outcomes on the planet, wouldn't you? Well, the data, it tells a very, very different story.
Let's just take life expectancy, for example. You'd think more money equals longer lives. But nope, despite all that spending, Americans on average actually live shorter lives than people in places like Japan, Switzerland, and Australia. And get this, all of those countries spend a lot less on healthcare than the US does.
And it's not just life expectancy. The same kind of story plays out when you look at infant mortality. The rate in the US is it's a lot higher than the average for other wealthy nations. It's another really troubling piece of this whole puzzle. We're spending the most, but the results, they're just not matching up.
Okay, so what does all this mean for you, for me, for everyday people? Because these giant trillion-dollar numbers aren't just abstract. They have very real, very personal consequences. Let's drill down and see how all these costs end up squeezing the wallets of regular families.
You know, one of the biggest changes we've seen in U.S. insurance lately is the rise of what are called high-deductible health plans, or HDHPs. The deal is pretty straightforward. Your monthly payment, the premium, is lower. But, and it's a big but, you're on the hook for way more of your actual medical bills yourself. We're talking thousands of dollars before your insurance really starts to pay its share.
And what happens when you ask people to pay that much money out of pocket? Well, it's pretty much what you'd expect. The data shows that when people are staring down these high costs, over half of adults just put off getting care. A quarter of them skipped filling a prescription or tried to make their pills last longer, and a whole lot of people couldn't get the mental health care they needed. I mean, these aren't just numbers on a chart. These are really dangerous choices people are forced to make between their health and, paying their bills.
And for some people, it gets even worse. Those tough choices can lead to complete financial ruin. Think about it. Even if you have insurance, one bad accident or a serious illness can leave you with just crippling medical debt. In fact, this one study found that medical bills were a factor in almost half of all personal bankruptcies. That is just an absolutely staggering statistic.
Which brings us to the multi-trillion-dollar question, doesn't it? If all this money isn't buying us better health, then where in the world is it all going? Let's try to follow the money and see what we find.
Well, for starters, a huge slice of that pie is eaten up by paperwork, administration, all the stuff that goes into planning, regulating, and just managing the system adds up to 8% of all healthcare spending in the U.S. Now, 8% might not sound like a lot, but it's 2 to 3 times more than what other countries spend. That difference alone is hundreds of billions of dollars.
Okay, so besides all that admin costs, there's another really big driver. The simple price of things. Just look at this. For the exact same thing, like an MRI scan, the price tag in the US is just worlds apart from other countries. And what's really important to get here is that it's not because Americans are getting more MRIs, it's because each individual one just costs a whole lot more.
And that price difference, it applies to labor too. On average, doctors in the US are paid a lot more than doctors in other developed countries. Now, of course, there are a ton of reasons for that, but it's definitely another key piece of this whole cost puzzle. But here's the thing. It isn't just about the price of a single scan or a doctor's salary. The very structure of the system itself seems to keep costs high.
Yeah, the system is so complex that it creates some interesting potential loopholes. Take this, for example. There's a rule that says insurance companies have to spend at least 80 cents of every dollar you pay them on actual medical care. Sounds good, right? But what happens when the insurance company also owns the hospital? Well, as this comment points out, there's a worry they could just pay their own hospitals super high prices. That way they hit that 80% target on paper, but the total cost of care stays sky high. So when you've got these massive costs and these really tangled, complex problems, it's absolutely no surprise that the debate over how to fix it all is one of the most heated arguments in the entire country.
One of the ideas you hear about all the time is moving to a single-payer system. The basic idea is that one public agency, like the government, would pay for everyone's health care. So, no more private insurance companies, but your doctor's office and the local hospital could still be private businesses. So, what would that actually look like? Well, the Nonpartisan Congressional Budget Office, or CBO, took a deep dive into that very question.
And what the CBO found is that, well, there are no magic bullets here. It's all about trade-offs, really complex trade-offs. On one hand, a single-payer system could actually lower how much the country spends on healthcare overall, and you wouldn't have to pay those monthly insurance premiums anymore. But on the other hand, it would mean brand new, pretty significant taxes, and it might even cause the whole economy, the GDP, to shrink a bit. It really just goes to show that any big change like this means making some really tough choices about what we prioritize.
So at the end of the day, here's where we're at. A system that leads the world in spending, but gets pretty average middle-of-the-pack results. The data, it lays out all the symptoms pretty clearly. The real challenge, the great debate, isn't about the diagnosis anymore. It's about the cure. What's the right prescription? And honestly, that remains one of the biggest and toughest questions the country is facing today.